Hello YouTube, welcome to Dr. Vibes, a learning point. In this video we will study about the gangrene, especially the gas gangrene. So what is gangrene? It is necrosis with superadded infection by saprophytic organisms. Now what is gas gangrene? Gas gangrene is caused by Clostridium perfringens, which is a gram-positive anaerobic spore-bearing bacilli. Now these Clostridium perfringens are found in the soil and the feces. Let us study about the pathogenesis. So from the soil and the feces, if there is a contaminated wound, then the bacteria or the bacilli will enter into the body. They will release the proteolytic enzymes like collagenase, hyaluronidase and protease. Now these enzymes will lead to the destruction of tissues surrounding the part of infection, leading to rapid spread through the subcutaneous level. Now this pathogenesis is not mentioned in the slide, but whatever I have said, you please write it down. Now, the Clostridium perfringens usually infect the wound that are heavily contaminated by dirt and soil and foreign bodies. And they usually attack the people who are immunocompromised. Like suppose those who have uncontrolled diabetes mellitus, or those who have cancer, or those who are on long-term steroids. So, if there is a wound or infection in such individuals, then the bacilli will enter through the soil into the body and causing their infection. Next are the clinical features of this gas gangrene. First, obviously there will be local pain which will be out of proportion of the size and nature of the wound. Second, there will be swelling and there will be release of the brown exudate from the wound. Third, crepitus, which is very important in gas gangrene, will be formed due to the gas producing organisms. Now the extent of the infection is usually more than what is visible to our naked eye. And if there is delay in presentation, then the patient may present with circulatory collapse and organ failure. So how do you diagnose gas gangrene? So mainly it is a clinical diagnosis on the basis of the history that the patient is given and the clinical features which have been mentioned. Now, this diagnosis and prompt debridement should not be delayed for radiological confirmation. Then, you have the digital x-rays of the affected part that can show the gas inside the wound. And the best investigation would be the MRI. How to manage this case? As soon as the gas gangrene is suspected, large doses of IV penicillin and aggressive surgical debridement is to be done promptly. That is surgical debridement and giving of penicillin intravenously. This is the management and everything about the gas gangrene.